Debbie Cote says her mother deserved better. The 73-year-old died from COVID-19 after a massive outbreak hit her long-term care home.
She could barely breathe. We just worried and worried and worried every day, my sister and I.
What happened there is part of a grim Canadian comparison. Ontario homes have seen 15 times more deaths than those in British Columbia.
That has to do with our government taking very decisive action immediately and having a very coordinated approach.
That approach kicked in shortly after the province reported its first case in a long-term care home in early March.
There have been many, of course, emotional days and difficult days with COVID-19 for a lot of people, but that was a day that I'll never forget.
Health officials quickly took control. They had one organization distribute personal protective equipment to all the homes. They made sure staff were assigned to one facility only, not working at multiple locations. Then they increased the pay.
In other words, if you were choosing between facilities with different rates of pay, the ones with the lower rates of pay would have inevitably had no workers under those circumstances, which didn't make any sense.
Ontario has tried some of this, but the union said it was too slow, including the pay increase.
It has not started flowing in the vast majority of facilities in Ontario.
She's gonna love this tree.
Sadly, it's all too late for Cote's mother. She's now planting a lilac tree to scatter her ashes nearby. She wants to be close after having to stay so far away when her mother needed her most. Ashley Burke, CBC News, Ottawa.